Child's perspective and information are important in clinical decision-making, and parents need important education to help keep their child healthy. This is the main source of the child's healthcare comes from their family. The child never goes to the doctor alone, so you want to make sure that the family is always involved and put as a priority in the family. Learning steps in cognitive domain. Knowledge requires recall of information. Comprehension combines recall with understanding. Application takes new information and uses it in a different way. Analysis breaks down communication into constituent parts to understand the parts and their relationships. Synthesis builds on the previous levels by putting the parts back together into a whole. And evaluation judges the value of what has been. You want to make sure you include all of these aspects of the cognitive domain, because when you're thinking, you want to think of the whole thing. You want to be really well rounded. Make sure you're not losing.
And as like you go down the list, it progresses in like applications. So like the younger kids are gonna just like be very basic in knowledge comprehension, have little synthesis and evaluation. Whereas like kids like us and teenagers and adolescents, they'll have like a higher function in synthesis and evaluation and comprehend more, be able to apply to more things. So you have to think of this when you're kind of like addressing children, and then also addressing parents too as well, because their children could have higher levels of thinking than their parents as well.
You also might want to, when you're teaching the family, the parents, you might want to teach the parents one way, like more advanced, and teach the kids kind of a simpler method so they understand, and try to help encourage the parents to teach the kid or still teach them in the most simplistic fashion as they understand the general concept.
So family-centered care is so important because the family is the center and sometimes the only constant in a child's life. They grow up with that person. Like, you're never without your parents if you're in school. And third, nursing responsibilities. You have to realize how important family is to the child's care and make sure that you include them and their values and priorities. I know we talk about a lot how faith is really important in care, and that's when we share throughout the family. And you want to form a partnership and collaboration with the parents that you're all making decisions together.
And you want to include the parents on like all the decision-making processes, because that's one thing that's gotten like nurses, especially in trouble, is when they start like doing stuff without the parents like knowledge consent. And especially like in an emergency situation, you want to confirm one of the parents what's happening. You don't want to just kind of keep them out of the loop because like they are about their pain. Like it's different than asking them to go, they can consent. When a child, they can't consent without the parents.
You also want to foster their autonomy as well. So like as the parents may choose to do like a spinal tap on the child, you want to foster their autonomy by saying, well, we're going to have to do this procedure, but would you like to hold your stuffed animal versus your red one? So they're kind of engaging into their care as well, and they don't feel left out or like dehumanized.
Nursing implications. Nursing need to have the highest degree of flexibility in the nurse, patient, parent decision-making process together. So everyone kind of needs to be kept in the loop at all times. And I think some of the tricky cases too, especially is if like the parents are divorced and they don't get along, both parents do have a say in it, and you have to kind of get everyone on the same page. So you have to inform the parents about what's happening and basically like, hey, this is what happened, it's happening. We need to investigate your child better. Are you okay with what? And ask them what their thoughts, concerns, or all about.
Flexibility is really important because no two families are the same. So every shift you're going to be dealing with new situations, and you need to be able to adapt.
You also have to think about how like the kids are handling it, the parents are handling it. Because if it's say their first kid, they may start reacting more like emotionally than say the second or third kid. Because like I know for like my parents, like when I was the oldest, they always kind of reacted differently from my brother. So you have to kind of keep that in mind too.
And understanding what we're going to talk about soon is their like style of parenting and how you adapt to that as well.
So some bigger stressors are separation anxiety, medical treatment, not understanding death, And so for the kids, some of the biggest stress is when they have to go do a test and the parents aren't allowed to come and they have to be separated. So that's when you might want to give the kid, say, let them choose, like if they want to bring a bear with them or stuff, and or if they want to do hold your hand, go down and go through the procedure. Because a lot of it is scary. Some of the big machines make a lot of noise, people are scared.
And for separation anxiety, it starts at 6 months old. So the simple thing to help with that is make sure that the parent can hold the kid or that the child can see where the parents are in the room.
And for adolescents, the biggest stressor is like their future and like changes to that. Because when they're teenagers, you kind of have a picture of what your life is and what you want to be. And then when say like you get injured and can't walk well, or you become paralyzed like from your legs down, that's a big impact on a kid's life, and that can really stress them out because they don't know how their life is affected at all.
And as I said before, how family is the constant in a child's life, it's also the same with parents. You get obviously very attached to your child, and that's such a constant in your life, taking care of your kid and being a support system for them. So you have to remember that their parents, their family is the constant while you come and go along with the other service systems and personnel.
These are the different styles of parenting. Authoritarian focuses on obedience, punishment over discipline. Authoritative is creating positive relationship and enforcing rules. Permissive is they don't enforce rules, and kids will be kids. Are lackadaisical about it, and they let the kids do whatever they want. And uninvolved is providing little guidance, nurturing, or attention. This is just explaining it more.
And when you kind of when your nurse entered you for the first time, you may want to try to pick up on what type of parenting is done too, because that might help influence how the kid's going to react. And if a kid's used to being told like what to do most of his life, it may not be as like he does have like his good input. His like medical treatment, he'll look at parents to make all the decisions for him. Whereas say a parent that's more relaxed will let the kid kind of decide what he wants to do, maybe for himself if he's old enough, compared to a parent like forcing it down.
And also understanding that there is no perfect parent. As like some parents may be down like the bottom right corner with neglectful, how like you as a nurse can enforce them or encourage them to like be more permissive or authoritarian, like on like a higher level, while not preceding that line of boundary. And then on the opposite end, in like the upper left corner, where there's strong, high, authoritative, how you can bring it down and kind of let the child be more of a kid and kind of like progress throughout their life as like they may have.
It's important to come off as like you're non-judgmental, because if they think that you're judging, then they'll start with your therapeutic communication.
Parenting styles, depending on their parenting style, it may lead to friction between family and nurse. We're always looking out for our patient first. Sometimes education is needed with parents. And permissive parenting, you need to enforce your kids' healthy meals, but if BMI is above the recommended with age. And with all parenting, you may have to sit down and discuss the importance of supportive of the child. Stressful experience.
How to address parents, exchanging complete and unbiased information between families and professionals in a supportive manner at all times. Appreciating families and children as children, recognizing that they process a wide range of strengths, concerns, emotions, and aspirations beyond their need for specialized help and developmental services and support. We always want to make sure you're not only educating the family, but also educating the child so it will reduce stress and questions that they can have in the future.
Based on the family-centered care principles, the family is centered to the child's health and pediatric care, which is focused on the partnership with the family. If you think about it, once the child leaves the hospital, its parents are solely responsible for their health. And parents are super resourceful, you should tap into their knowledge. They know their sleep pattern, their diet, how to prevent their methods. So it's important to ask them all these questions and then respect their like my kids sleep sleeps at 9 o'clock specifically every night. It might seem like a little crazy at first, but it's important to them to support the child.
So these are cases that I've experienced throughout my clinical experience so far. So we had a child that presented to the PICU with attempted suicide. The child is currently mechanically ventilated and on critical life support. The mother is the direct caregiver and the power of attorney. She decides to keep him alive with very minimal chance, if any, to regain basic qualities of life. So I had this parent, and they were very direct into the care of this child. And brothers were Olympic athletes, and they came talking to the child and no response. It was very hard on myself and the nurse, but we had to understand is this the respect decision? So as a crowd, do you guys think this is the right decision to keep this child alive? Is mom correct that if their child committed suicide, are they worth living on this kind of quality of life?
Do that pause, and then like the pregnant pause, and then go on to the next.
So, and then the next question would be, how do you care for this patient and family? So you have to understand the mom's values along with the family's values. So what are some different ways you would address the family, address this child, and then go for caring for them while this parent, they're engaging in their care, and kind of addressing them as well. So case number 2, a child presents to the NICU, medical intensive care unit, with an end-stage metabolic disorder. The condition is progressive, and they expect death within the next year. The child expresses to a previous nurse to be a DNR, a DNI, along with hospice care. However, the child slips off into a coma 3 days later without change in advance directives. The parents, as power of attorney, choose to keep the child alive as his body decomposes and suffers after months. The family strongly believes that he or she will wake up. So the question is, where is the line the nurse draws when caring for this patient? So as a nurse, you know there is no hope for this child. He has a progressive disease that is taking over his body, and his body is deteriorating in a sense. Where as a nurse do you take the power to go and talk to his family, and what is it in your scope of practice to say to this parent, maybe we should bring this child back to a DNR or DNI, and how do you address this?
We have a Kahoot. There's 5 questions. So which learning step builds on the previous levels by putting the parts back together into a whole? True or false, family is the center and constant in a child's life. Which of these is not one of the greatest stressors of children? which definition best fits the authoritative parenting style? And the last question is, you should not use parental knowledge when providing care for the child.
And these are our references.
Okay. Stop. Okay, so I guess we can stop. He said exit. We can exit. Stop. Yeah, stop sharing. Snacks.